Hi, everybody. Thank you for joining our Autism Consortium webinar on this February Friday. We're going to give folks a few minutes to join and then we'll get started.
Yeah, I think some people are still joining, but I think it's okay if we get started. Um, Welcome everybody to the Autism Consortium of Texas. And I want to introduce our speaker for today, Meghan Burke. And Megan and I know each other. We were at University of Illinois Chicago together. She was a postdoc, and I was a mentor for her at that time on a project that she had. And then Megan was became assistant professor and went through the ranks at University of Illinois Urbana-Champaign, and she's currently at Vanderbilt University as a professor. And her primary line of research includes developing and testing interventions to improve access to services and ultimately outcomes among individuals with IDD and their families. And all her research focuses on individuals with IDD, their families, um, including siblings and parents. And most of her research does focus on autism. And so I think Megan and I have a lot in common in our research in terms of empowering families. And, um, a lot of what Megan has done is really empowering families with advocacy, knowledge, and experience in the school system. So I'm going to pass it on to you, Megan.
Great. Thanks so much for having me. So my talk today is about improving service navigation among families of autistic individuals. And as many of you probably know or familiar with, either professionally or personally, there are a lot of barriers to accessing services among families of people with disabilities, including autism. And we could spend the next hour and a half just talking about all of the barriers and all of the obstacles that people with disabilities and their families face in accessing services really across the lifespan. But instead of doing that, I try to summarize some of the barriers in brief snapshots. So I like to show this comic strip by Michael Jean Greco, and it shows a series of professionals on one side of the table and then a parent and an advocate on the other side of the table. One of the professionals says, "I'm not sure why Mr. Barth always feels compelled to bring an advocate to the IEP meeting." And at the bottom, it says outnumbered question mark. So a lot of these meetings, whether they're early intervention meetings, IEP meetings during the school system or into adulthood, a lot of meetings often have a series of professionals who are kind of like on one side of the table and the parent and the person with disability on the other side of the table. And whether it's intentional or not, it can feel very disempowering as the parent or the person with a disability. It can feel very kind of us versus them. It can feel very much like the parent and the person with disability is not an equal member of the team. And so that's why a lot of our interventions really focus on advocacy and trying to empower people so that they can speak up in these meetings. Now, I'll also say that my interest in parent advocacy and how families navigate service delivery systems is definitely personal. So in this picture on the left, you'll see a picture of my brother. He's now 32 years old. And in the picture, you can tell that he's a person with Down syndrome. I'm the oldest of five, and Ryan is number 4 in line. And I remember when we were younger and Ryan was transitioning from early intervention into school services, the school district wanted him placed in a segregated self-contained classroom only for kids with disabilities. My parents wanted him in a gen ed classroom. They couldn't come to an agreement, so my parents filed due process against the school. My parents prevailed, and then in due process in Illinois, the losing party has 120 days to appeal. The school district appealed on the 119th day. We went to the next level of court where my parents prevailed. The school district appealed 119 days later. It went all the way up to the Seventh Circuit Court of Appeals, where we prevailed and the school district stopped appealing. I share that story because this is very personal to me. This is definitely something that kind of drives my research agenda. I also share it because it really impacted me. I remember going around to neighbors and asking them to sign a petition for inclusive preschool programming. I remember going to legislators with my mom and talking about Ryan's case. And I remember actually going to the Seventh Circuit Court of Appeals and hearing my dad argue Ryan's case. It's also really important to me because part of my research really looks at trying to salvage the family professional partnership. And if you ask a family who's filed due process against the school, what did you do after the hearing concluded? A lot of families will say, we put a for sale sign in our front yard and we moved. Because at that point, your relationship with the school system is so fragmented and litigious that it's unsalvageable. And so in our interventions, we really focus on advocacy that's non-adversarial and trying to keep a relationship between the family and the school. Now, on the right side of the picture, I've just added another picture. I now have more personal experience. So this is a picture of my son, Rogan, who's actually now in 5th grade. That he's holding a sign that says 4th grade, but he has autism. And so now I'm experiencing it not from the sibling side, but from the parent side of having to advocate for him and really trying to understand ways to better support families as I also navigate the systems.
Jay is 21.
Sorry, before I show you the next video. So I've kind of like tried to encapsulate some of these barriers that families face in accessing services. The next thing that I'll show is a video from a parent who's in Massachusetts, and she's talking about what she wants changed in special education law. And I think she does a nice job describing her own family's experiences in navigating systems and why we need some change. So I'm going to turn it over to her, but that's the kind of context.
Jay is 21 and Anand is 18. My young, wonderful, amazing younger son, Anand, has autism, but autism does not define him. My biggest concern is not only access of services, but knowing of one's rights and possibility. Parenting is hard in itself, and having a child with disability impacting his and everyone's life around him, it's even harder. I wish there was a manual to raise a kid and another manual for navigating the system for services. I wish I had known 14 years ago what I know today. Every day we learn something new from our kid and something new for our kid. Fighting for every little thing with school and system, it's very, very frustrating. And we shouldn't be spending our energy on that. We need to change that. Our kids need our patience, our energy, our knowledge. The better school system, which gives kids what they need, is needed. We need a way to explain what should be done and how it should be done. A manual to explain the system, services, possibilities, what is available, on what can be done in a better way. We need some resources to explain the families who are new in this, who have no idea what is in it for them in future. I cannot turn the time back for my son, but I decided to help the other moms who are in the same situation. I share my knowledge. I bring moms together so they can share their concern, share the ideas, and be there for each other. I built the Moms Network for Indians moms so they can come together and build a bridge between two different cultures they share. I wish I could have done it earlier. I wish I could have done it in a better way.
I'd love to hear what people think of that, like what resonated in her video, if there was a certain message or thing that you thought, oh gosh, I understand that feeling, or wow, I'm surprised that she said that. If you want to write in the chat. Oh, I wish I knew then what I know now. I know. I think that sentiment of like guilt is really strong here, and we hear that from a lot of families. I also appreciated how she said we need a manual to raise our child. I have 3 kids, so I wish I had a manual to raise my kids. Um, you agree with her. She created a whole network for her community and this like pay it forward so other families wouldn't experience what she did. So it's a really lovely sentiment. Knowing others definitely helps. That social capital matters. Yeah, she talks a lot about her own culture, being an Indian mom, struggling with accessing services and the kind of cultural divergence. These are great answers. Yes, definitely stigma. We're going to talk a little bit about culture later. Yeah. Make sure I don't miss anybody. Being proactive. Eileen, I see your question in the question and answer. If we get to that, I'm happy to respond to that. All right, I'm going to keep going. So, kind of my agenda for today is to talk about 2 current research projects that we have. We have a lot of interventions right now and research projects that are really looking at how families navigate service delivery systems, but for the sake of brevity, and really wanting to dig into a few things versus just kind of giving you a service level understanding of what we have, I thought we'd look at these 2 projects. So on the left is a project called SE Steer, and on the right is our Section 504 project. And so we will start with our SE Steer project. So this project is actually in the context of adult service delivery systems. So Eileen, your question about aging off of a parent's insurance is very relevant here. Adult disability services tend to be underfunded and they are very difficult to navigate. And so the picture on the right shows somebody falling off a cliff. And I put that picture there because parents of people with disabilities will often say the transition from school to adult disability services is like falling off a cliff because it's very hard to navigate. Unlike school systems that are all within one silo, the school, that are generally kind of prescribed by one policy, adult disability services are siloed in different service delivery systems accorded by different policies with unique eligibility criteria, norms, bureaucracies, and just entirely different systems to navigate. And so they're very hard to understand how to access services. So to address that, with my colleague Julie Lowndes Taylor and Leanne Smith DeWalt, who's at University of Wisconsin at Madison, we developed a 24-hour advocacy program called Assist. And it is 24 hours, so it's 2 hours per week for 12 weeks. It's a cohort, so people mention like social capital, relying on other families to understand your rights. We also leverage that in Assist, so it'd be about 12 to 15 parents who meet every week for 2 hours to talk about one type of adult disability service. And it was geared for parents of transition-aged youth, age 16 to 26. It was specific to autism to learn about how to navigate and access services. And it was informed by autistic adults and their families and professionals. And one of the nice things about this project is that it's not designated for youth with a specific type of support need. It was really supposed to be meeting the needs of youth across the spectrum of functioning. And we addressed all the different topics that are in the figure, so secondary education, housing, medical, including health insurance, person-centered planning, special needs trust, employment, non-adversarial advocacy, post-secondary ed, conservatorship, and special needs trusts. So it was a pretty intense intervention. Thankfully, we ran Assist in a randomized control trial in Tennessee and saw really positive results. So the parents who went through the Assist training demonstrated significant knowledge about adult disability services, greater advocacy skills, and greater empowerment. We applied for a bigger R01 grant from NIMH to do a multi-site randomized controlled trial. So on the left of the slide, you'll see a picture of Illinois, Wisconsin, and Tennessee. So we ran the ASSIST project in each of those 3 states to see if we could also get significant results, which thankfully we did. But I actually am not going to spend a ton of time talking about ASSIST here because I want to show you something relevant to the demographics. So what you'll see on the right here are our participant demographics. And we had about 186 parents of autistic youth sign up for ASSIST, which is a big sample. And as we would expect, and as is pretty consistent in all of my interventions, they're primarily moms. They're relatively highly educated, relatively affluent. And what you'll see here is that we did not have that many Latino families participating in the intervention. So they're primarily white. And this is a problem because we know that there are great systemic barriers facing Latino families, especially Latino, primarily Spanish-speaking families of kids with disabilities. And so let me give you an example. Here in Tennessee, we, just like every other state, have Medicaid home and community-based supports. And those are our waiver services for adults with disabilities, including autism. In Tennessee, we renamed it and we call it ECF, or Employment and Community First Choices. That's the name of the big waiver that serves most adults with disabilities, including autism, in our state. If you go to the state website, this is what you will see. You will see information about ECF choices. At the bottom of the website, you'll see that there is a tab that says Translate. So you're probably thinking, great, if you're Spanish speaking or you speak a different language, you can translate it. And that is true. You can translate that into another language. So it translates it into Spanish, and then you'll see here this kind of middle spot says, okay, you can complete this form online to refer yourself to get ECF Choices waiver. So you think, great, there's no problem for people who are doing this in a different language because they can just click this application. And it takes you to the ECF Choices referral form in English. And there is no longer an option for translation. So you are literally completely cut off at this point in trying to apply for just one of many different types of adult disability services. And so the fact that we were underrepresenting Latino families in our sample, the fact that we know that there are greater systemic and/or unique barriers that impact Latino Spanish-speaking families, we thought, okay, this is something that we should really dig into and address. And so here I want to stop and be very clear that I had a wonderful doctoral student named Janet Elman Tovar, who's now at Cal State Fresno as a professor, and this was part of her dissertation. So for her dissertation, she adapted ASSIST into what we call Assistir, and she did it for Latino transition-aged youth of kids with autism in Spanish. And she adapted half of the training and then ran it. And then we were lucky enough to get an R03 where we adapted the other half of the training and we ran it in a randomized controlled trial in Illinois. And so we were really testing to see whether or not Assistir can be helpful with Latino Spanish-speaking families of autistic youth. Just like Assist, Assistir is 24 hours of training. It's 2 hours per week. It's conducted entirely over Zoom. It was facilitated by the ARC of Illinois, specifically by a Latina mother of an adult with autism. She facilitated all of the sessions, and it's entirely offered in Spanish. So I want to walk you through a little bit about the cultural adaptation process that Janeth really spearheaded for this. So it's not just about forward and backward translating the materials and then saying, okay, this is culturally responsive. Janeth not only forward and backward translated all of the ASSIST materials, but then she also had kind of an expert committee that was comprised of 3 Latino parents of youth with disabilities who really looked over all of the different curricular aspects and gave feedback about what would need to be changed. Then she looked at the literature to understand what do we know from literature about these different barriers that Latino families are facing? How can we embed that into the curriculum? She then used the ecological validity framework, which I have pictured on the right, which has 8 different dimensions, including language, persons, metaphor, content, concepts, goals, method, and context. And she looked at each session to make sure that she was adapting it for each of these dimensions to make sure that it's culturally responsive. And then she took all of the curriculum, she split it up into chunks, and she interviewed 8 Latino caregivers of autistic youth. She interviewed each of them 4 times, going over chunks of the curriculum in each of the interviews and getting their feedback on, is this accessible? Is this addressing all of your concerns? Is this something that you think you need? Are we missing something? So she did a really in-depth dive in making sure that we were making a curriculum that was going to be useful. So that led us to Asistir, which is, again, a 24-hour program for Latino families of transition-aged youth with autism. And so at the beginning of every Asistir session, there is a video. And so this provides kind of nationally relevant information about the type of adult disability service that's being talked about in the session. And it's facilitated by a Latina mom of a young adult with autism who walks you through nationally relevant information about that adult disability service. And we have all of those videos publicly available at the ARC of Illinois' website if you're interested in watching them. They're about 10 to 15 minutes long, and they're pretty accessible. So for the randomized control trial, on the left, you'll see kind of our flow chart, which you'll see that we had 57 people who kind of initially were interested, and then we ended up randomizing 48 of them. So 24 in the intervention group, 24 in our waitlist control group. We did have some attrition as we got further down, but overall, a pretty healthy randomized control trial. But what I want to point you to is on the right. So on the right, you'll see a table of our 48 participants. On average, their age was between around 40s, just like our assist sample, primarily moms, which is, again, very consistent in my research. It's primarily moms. But unlike the assist sample, we have a sample here who has less formal education and less income than the assist sample. And I think this is important to note because even though there are differences demographically between the samples, we still saw pretty high attendance for all of the sessions. We still, as I'll show you, saw really great gains among the participants, and we also saw some really high social validity. So I think that's important to point out. So what did we see? Basically, this graph shows you proximal effects. Proximal effects are at the post-survey immediately after completing 12 weeks of Assistir. Did we see significant gains in their knowledge of adult disability services, their advocacy activities, and their comfort with advocacy? And thankfully, what we saw are significant increases for our intervention group and not our waitlist control group, meaning, yes, they know more about adult disability services, and they're not only more comfortable advocating for their child, but they're also doing more advocacy. So we're very happy with that. What you'll see here is the level of impact on empowerment. And so our empowerment measure that we tend to use has 3 subscales. One is your empowerment within your own family. One is empowerment in navigating and accessing services, and one is empowerment within the community political system. And so here, we only saw significant increases within the community political system. So this means that families felt significantly more empowered after taking Assistir in accessing systemic changes within their communities, maybe talking to legislators, maybe getting a media campaign going, something that was really more global, which is a pretty beautiful finding. What I also want to point out in another paper, we compared the assist families, which is a pretty heavily white sample, to our Assistir families and looked at how they compared on empowerment, advocacy, and knowledge. And what you'll see in that paper is that our Assistir families have significantly more family empowerment than our assist families. And so here in our family empowerment subscale, it's really seems to be more so a fact of they've ceilinged out at baseline. Like they're so empowered within their own families on average that there's no room for growth. And so this is like a huge strength that should be leveraged in our interventions, but doesn't necessarily need to be targeted for improvement, at least for our Latino families. And then in terms of distal effect, so what we did in this project is, I think it was 6 months after they took Assistir, we surveyed them again, and we said, okay, now we're really interested in seeing the effect on your autistic youth. And so we did it 6 months later because it tends to take a while to try to navigate and access services. So we were trying to give enough time between the intervention for them to actually apply for and receive a service. And we looked at the number of services the autistic youth received and the unmet service needs. And what you'll see is that for our intervention group, at 6 months later, they received on average one more service than our waitlist control group. So not only are we seeing a nice impact on parent level outcomes, but we're also seeing some impact on child or youth outcomes too, which is pretty exciting. So I'll pause there with that study and see what questions we have. For the videos on the ARC Illinois website, I think some of them, like SSI is going to be nationally relevant, SSDI will be nationally relevant, I think SNAP will be nationally relevant. The Medicaid waiver one might be more specific to Illinois. You would have to look. But I will say that's the ones in Spanish. On the ARC of Illinois' website, we also have all of the assist videos available, and those are all only nationally relevant information. So the ones that are in English are only nationally relevant. So that could be used anywhere. Did you find that you had to do extensive outreach to get Latino families to participate, or was there already a queue of, yeah. Well, this one I really have to credit Sandy, because when she said she was my mentor, I still consider her to be my mentor. I have learned a lot about trust building and community outreach and partnership from Sandy and her work. So we did not do a ton of extensive outreach, I would say. And I think that's because I had been doing some research before this that was about school services with Latino families. And so we had a list of people who had already met me, knew me, that we were able to reach out to who are now eligible for this study, which I think helped quite a bit. But also, and probably most importantly, we worked really closely with the ARC of Illinois, and we worked really closely with Grupo Salto and have community partnerships with them. And they did a lot of the recruitment. And so, knock on wood, recruitment wasn't that hard for this study. Are there resources for pro bono legal assistance for conservatorships? That's a good question. I don't know if there's pro bono legal assistance. You might want to check your protection and advocacy agency to see if they have a list of pro bono legal assistance for conservatorships. I'm not sure. I'm sorry.
And that would be Disability Rights Texas.
Thanks, Sandy.
Yeah.
Eileen, we could circle back to your question now. Your daughter is about to age out. I mean, if she's about to age out like she's 26, then if you do have her designated as somebody with a disability, then you might be able to, sometimes private insurance will have special provisions for them to stay on the parent insurance. But also you can look into other things like Medicare as other options for health insurance. Do I find it harder now in this climate? I don't know. I have put in a few grant proposals to scale this up across different states, just like we did with Assist. If we get funded, I think we will find out if it's harder now in this climate to do participant recruitment. I'm not sure. Is there a similar site for Texas? I don't know. Sorry. Oh, yes. Did the control group get access to Assistir after the study? Yes, they did. I think all of our studies are waitlist control groups. We always make sure we give everybody access after the intervention group gets it. I think that's really important. Other questions? I hope I'm not talking too fast. I live in Tennessee now, but I'm originally from Chicago, so I feel like I'm a fast talker. With the increase in support and education, what is one main benefit that you saw in the community? That's a great question. You know, I think, I think the benefit that we see in the community, it's not as well displayed in SC Steer, but it was better displayed in our special education intervention that we did in Spanish, is that families who participated, there was a significant increase in advocacy for their own child, but we saw a lot of families say that they were helping other families for free in accessing services. And so it's really that like peer support. And even in this one, like significant increases in community and political empowerment. Like to me, that's the biggest, that's the main benefit, right? Is that we're not only hopefully positively impacting people who go through the intervention, but we're able to make some real change for people who are not able to go through an intervention like this. I think that's the best benefit we could have. How did participating families find us? We found them. I would say we really worked hard. So we used registries that we had of people who had participated in the past. We used listservs from the Arc of Illinois and Grupo Salto and social media to share information about the study. We did a lot of warm reach outs. Thanks. Were the families surveyed had adults? Oh, good question. So in assist, we had a pretty hard cap of the youth had to be between the ages of 16 to 26. And for SC Steer in Janeth's work, when she asked families, Latino families, when do you want this information? A lot of them said, I want it when my kids are 12 or 14. Like they wanted it younger versus than older. And so for SC Steer, I think we had a lower age, bottom age limit. So it was like 12 and up. But it is an interesting question and something that we weren't really able to get at with the kind of smaller data set is like, when do you offer this information to families? Because a lot of the information that we're sharing is you can only use it or act on it when the youth turns 18. But some families want to know what's coming up earlier. Some only want it right when they're going to need it. So it's a good question to try to understand when's the best time to offer this type of information. Oh, I can look for that. It's kind of hidden when you go on the website. It's like under transition resources, like I think resources, transition, and then you have to scroll down a little bit and then you'll see it. If you can't find the link, I can always share it with Caroline after this. Okay, now I'll keep going. But thank you for the questions. Happy to answer more questions as we're going through it. So I'm gonna shift gears and talk about Section 504. So if you're unfamiliar, Section 504 is a part of the Rehabilitation Act of 1973. It's a civil rights statute. And basically, it's a federal law that prohibits discrimination against people with disabilities in any program or activity that receives any inkling of federal funding. So this would definitely include public schools. It would also include private schools if they have like a reduced milk money program that's federally funded or any kind of federal funding. Private schools have to follow 504. Camps, daycares, colleges, trade schools, pretty much any place that receives any inkling of federal funding has to follow Section 504. And what Section 504 provides is reasonable accommodations to people with disabilities. Common reasonable accommodations that we see in the school system are extended test taking time, preferential seating, the ability to take breaks, maybe having access to fidgets or toys, having adapted seating. Those are kind of typical accommodations, but that's by no means an exhaustive list. If you're familiar with IEPs versus 504 plans, this slide might be helpful to you. So on the left side, you'll see IEP, and an IEP is something that is accorded by the Individuals with Disabilities Education Act. It is a form of special education. An IEP, it has to be written legally. It's a binding plan. It has to have certain components in it. So it has to include evaluation results, which are your present performance levels. It has to include related services. It has to include annual goals. It has to include reports of progress. It has to be reviewed at least annually, and the parent has to be at that meeting, or at least invited to the meeting. And it specifies who else needs to be at that meeting, including a special ed teacher, a general ed teacher, and somebody who's representing the district. Now, compare that to a Section 504 plan. A 504 plan does not need to be written, which is very interesting. As you can imagine, it would be difficult to implement a plan that does not need to be written. A 504 plan can be anything related to the student's needs. It does not have to include all the components in an IEP, but it also could include all the components of an IEP. There is no set timeline that you have to review the plan. There are no required people who have to be at the meeting to develop the plan. So if for nothing else from this slide, you should take away that a 504 plan is much broader than an IEP. Overall, we know that 1.6 million students are served by Section 504 in public K through 12 schools. So a lot of the students who are served by Section 504 could be students with asthma, students with allergies, students with ADD or ADHD, students with other types of health conditions, but also students with different academic needs as well. What we also know is that 1 out of every 8 public schools says they have no student with a Section 504 plan, which should ring some alarm bells in your ears to say, that doesn't sound right. Doesn't sound right that you can have a school that doesn't have a child with a nut allergy or asthma or ADD or ADHD who would qualify for a Section 504 plan. And so it does seem like this, in combination with some of the very limited research we have about students with 504 plans, that there are some issues around compliance with 504, and there are some issues around implementation of 504. So a few years ago, there was an RFA that came out from NIDLR, and which is a federal funded agency. And they were specifically interested in understanding how 504 is implemented in K through 12 schools. And we were lucky enough to apply for and receive that grant. It's a 5-year grant, and I think we're in year 3 now. And it had 3 phases. And basically, when they put this RFA out, from my read of the literature, there are about less than 10 empirical studies about 504 implementation in K through 12 schools, even though 1.6 million children have 504 plans. So we really don't know much about what's going on with student and parent experiences with 504s. So the first phase of our project was interviews with students with disabilities and their parents to just really, at a very exploratory level, say, how is this working? How were you found eligible? What was the evaluation process? How do you develop the 504 plan? What does it look like? How is it implemented? Is it implemented with fidelity? Did you ever have a problem with your 504 plan? Did you enact any of your safeguards? And these interviews were, as you'll see later, pretty long, about an hour and a half with parents and youth with disabilities. We have, I think, over 160 interviews that have been done with parents and youth with disabilities. So we had a pretty large number of interview data that we're still trying to sift through and understand, but really helped us get a much richer understanding of what 504s look like on the ground. From that, we conducted a national survey with youth with disabilities and their families to say, okay, well, what are we seeing in these interviews, and are these experiences generalizable? And another nice thing that we did in the national survey is we asked students and families if they were willing to upload their 504 plan. Because there's so much variability in what these plans could look like, we wanted to actually see some of them and compare and understand, okay, what are we dealing with here at a baseline level? So we've been analyzing some of those as well. Now we're in our 3rd phase of the project, which is taking all of these data, identifying some of the barriers that people are facing and getting, and having a strong 504 plan being implemented in the school, and developing a advocacy training for families and students solely about Section 504. And so we've piloted I think it was an 8-hour training in the fall to understand, whether or not it was working. And we're hoping to run a randomized control trial in this upcoming fall with a much bigger sample to see if an advocacy training helps students and families access supports under 504. But for today, I just want to dig into one piece of this. And so the piece that we've recently published was really just looking at families of autistic students who had 504 plans and trying to understand what their experiences were. And there hasn't been much research specific to autism in Section 504, which is really interesting because we know that autism is very heterogeneous. And so there certainly could be situations where a student could have autism but not qualify for special education services under an IEP and instead only qualify under a 504 plan. And yet we really didn't know anything in the research about what those experiences look like. So our 3 research questions for this study were: what are families' experiences in accessing Section 504 in the school setting? What were their facilitators to accessing supports under 504? And what differentiates kind of their positive and negative experiences? So in terms of our researcher identity, and you'll see this at the end of my presentation because I want to give credit to everybody on my team. Our team was comprised of 9 people, 1 professor, 1 assistant professor, 2 doc students, 2 master students, 3 researchers, and a research coordinator. And then 3 team members identify as family members of people with disabilities, and 3 identify as a person with a disability. In terms of participants, so we cut down our overall 160-person sample down to just families of autistic students. And so in this particular study, we have 23 participants. And as you'll see here, they're pretty geographically diverse, coming from all over the country, but primarily moms, primarily married, relatively like college educated sample on average. In terms of our interview protocol, like I said, these tended to be pretty long interviews. So we scheduled an 1.5-hour block for each interview. For this particular study, interviews were around 45 minutes. 22 of these interviews were conducted in English. 1 participant preferred it to be conducted in Spanish. After each interview was conducted, we did a member check. So we summarized the interview and sent it to the participant to make sure the summary was accurate. And 16 people responded and said, yes, that was accurate. We also had an independent researcher listen to all of the recordings, compare it to the interview protocol, and make sure that we were having fidelity to our interview protocol, which just means we asked all the questions we said we were going to ask, and we found fidelity to be 100%. So in terms of data analysis, we transcribed all of the interviews. Again, because this was really all exploratory, we did not have a list of codes already predetermined, so we just open coded for what we saw in response to our research questions. We developed an initial code book. We met to talk about what that code book should look like. We revised the code book, and then we used the code book and went back to our interviews and coded again. We came back, met, revised the code book again, and did another round of coding. And then we compared our codes between the researchers. And if we had any disagreements, we talked it out until we came to consensus. So in terms of our findings, what were families' experiences and just like the initial access of a Section 504? This is just the evaluation process. How did you get the 504 plan? Parents talked about the importance of private evaluations. So they talked about it was easier to get a 504 plan if they had a private evaluator, somebody outside of the school, say, yes, this child has autism. So this is Karen who said, since the school was not able to help, I went ahead and got the auditory evaluation for my daughter privately. That was like over $700. Other participants said the school did conduct an evaluation, but also the evaluations they felt like were not comprehensive. So Kimberly said her child, was evaluated in academics. That was pretty much it, even though I said it was more than that. I kind of had the struggle with getting anybody to take me seriously because my child is a high masker at that time. We didn't know that they were also autistic. And then finally, some participants said that the school refused to conduct an evaluation. They refused to look to see whether or not the child would be eligible for a 504 plan. So Mary said, really, they're only doing a full evaluation for an IEP. We're when services are involved. But locally for a 504 plan, they need a potential disability, which was already on record with this ADHD and then also with this autism. But they did not do any evaluations. So the school did not collect any data on their own. In terms of facilitators, so people said when we asked what helped you in getting a 504 plan, they said if the school staff was responsive, if the parent was knowledgeable and had advocacy skills and social capital. So Deirdre said the superintendent and the rest of the school were very kind and worked well together, which resulted in us receiving a 504 plan. So this is about the responsiveness of the school staff. April said, I'm an advocate. It wasn't something that had not been through before. I knew what I could ask for and what our rights were. I definitely think this was an advantage. So parents who were doing online research themselves, we had several parents who also identified as having a disability themselves, and so they relied on their own lived experience to be able to advocate and access supports. And then with respect to social capital, Macy said, friends made it easier receiving a Section 504 plan. There are other families that have the same diagnosis, and I'm in close contact with them. So we kind of get a heads up about what may be coming down the road for my child. This is kind of circles back to the beginning discussion and hearing from Jaya the importance of social capital and meeting other families that can really be helpful. Now, unfortunately, in terms of negative experiences, what we saw is they seem to be more common within our sample. And when we tried to understand, well, what differentiates negative versus positive experiences, it seemed that in some cases it was the exact opposite of what facilitates positive experiences, unsupportive and inexperienced school professionals, taking advantage when the parent didn't have the knowledge of their rights, negative effects on autistic children, and gender discrimination with respect to the parent. So as an example of unsupportive school professionals, Micaiah said the school claimed they couldn't give a 504 until the son was exited completely from special ed through the IEP. And that's actually not true. So then this is an important thing to kind of talk about is that you can have an IEP and a 504 plan. And it was specifically listed actually in the RFA for the grant as they wanted us to understand students who have 504 plans and IEPs. And yet we were clearly seeing in the data that people were saying, parents were hearing that they could not have both. And just to underscore this point 2 times over, as we were recruiting for this study, I called a friend of mine, her daughter has spina bifida, and I said, oh, does she have a 504 plan because she could participate in the study? And she said, no, she has an IEP. I said, okay, fine. And then a few days later, my friend called me back and said, your question prompted me to go and look at her IEP more carefully. And sure enough, she has an IEP and a 504 plan. She has an IEP that addresses her dyslexia, and she has a 504 plan that addresses the catheterization that goes with having spina bifida. And so I thought this was so interesting because this is a really savvy parent who didn't realize that the school team had disentangled those 2 support needs and put them in separate plans. So I thought, gosh, how many other families is this also happening to? And then a second way to underscore this is that I think for this particular article, we wrote this up, we said you can have both, and a reviewer was like, absolutely not. You cannot have an IEP and a 504 plan. And we had to write back and be like, you absolutely can. There is nothing that prohibits you from having both. And we even cited the RFA, and I went back to our program officer and I was like, we've had pushback against this. And our program officer was like, I wrote that in the RFA, you can have both. So lots of myths out there related to 504. Taking advantage of lack of parent knowledge. So Stella, she described the process as hostile, very contentious, very intimidating, and she felt like the board members made her feel that experience. She'd go to her school board and kind of talk about her experience with 504, and she said it was dehumanizing. The school board made you think you're crazy. They make you second guess your child. In terms of negative effects on the autistic children of the participants, Cindy talked about how she couldn't get certain supports under the 504 for her daughter, and that accordingly her daughter went a year without accommodations, and that her daughter experienced high levels of stress and no access to therapy. And then finally, in terms of gender discrimination, Melinda says, I don't think people always take women seriously. It was a really common theme in this sample and has been in a lot of my research, which again is primarily with moms, is that women feeling like their advocacy isn't taken as seriously. And I think in this sample, one of the moms actually said she kind of pushed the advocacy onto her husband because she felt like it was more effective coming from him versus from her, just because of the stigma that women face when they kind of challenge the narrative. Limitations. This is a cross-sectional study, so we're just getting one snapshot at one point in time. So it's really hard to understand, like, is this happening across a student's lifespan? Are they facing barriers in elementary versus high school, or are those barriers different? And so longitudinal research would be really helpful to kind of flesh all of that out. Also really important to understand the experiences of youth with autism and what are they saying about their accommodations. And so we do have a separate study that's just focused on the youth, where they talk about not knowing much about their 504 plan and the onus being on the youth to really enact their accommodations in the school setting and how that can feel really ostracizing and difficult to do. And masking came up quite a lot. It didn't come up in the findings that I shared here, but issues around students with autism being able to mask their behaviors. And so that made the school district say, you don't qualify because we don't see any of these behaviors, but really they were just masking them. And that became a really big issue around eligibility. So I'll stop there and ask for questions. What's resonating with you? Yeah. I don't know, Nicola, I agree. You would hope that none of these programs would have to exist because people are just not discriminating against people with disabilities. I'll give you a few more minutes in case there's any questions or comments. Oh, good. I'm glad it's resonating. Are there consequences? That's a good question. So, I mean, if you as a parent feel like the school's not following your 504 plan, you can file a grievance. You can file an Office for Civil Rights complaint. You could also file for mediation or due process. So those would be potential consequences. Um, yeah, those are potential consequences. There is definitely a huge knowledge gap. Yeah, this is a good point, Barbara. The IEP definitely has more teeth in it than a 504 plan. So the IEP has things that are required, whereas a 504 plan doesn't. And so I think that is why people are told it's better to have an IEP versus a 504. I can understand that. Oh, somebody asked, what's the purpose for the school to do something like this and how can this be prevented? I'm not sure why they did that, to be honest. I'm not sure why they separated out the medical needs into a 504 and the educational needs into an IEP. I'm not sure if that was just like how they think about things, how they previously had done 504 plans for students who need catheterization. Um, Ultimately, as long as the student's getting what they need, it really doesn't matter if it's separated out. Um, but I think if you were trying to prevent something like that from happening, it could all be nested within the IEP, is just to really carefully look at the headings of your document and make sure that they're consistently saying IEP and that one of the heading isn't saying 504 plan, which would suggest that they're doing both. Yeah, good. I'm glad. I think everybody on our team, and I'll show a picture of them at the end, has some connection to disability, and I think that's important to share. Yeah, it is frustrating. Thanks for sharing that, Edward. Okay. I don't have that much left. Oh, what are my plans for research next? Um, Good question. Um, the 504 is the randomized control trial is the next plan for that type of research. Um, Other research that we've been for SC Steer, I've been putting in grants to scale it up to multi-site randomized control trial. So fingers crossed that might get funded someday. Other research we've been doing is like teaching special education teachers about adult disability services. We have an IES grant to do that, that we're piloting right now and hoping to do the randomized control trial starting in the fall. But we've created like mini modules for special education teachers to share with families and autistic youth. And so special education teachers can become knowledgeable about adult disability services and then share that information with families and youth. So that's definitely a next step. And then we have a different project that looks at integrated supports for adults with IDD. So that's really looking at the balance between formal and natural supports and trying to understand, is the balance that people currently have the balance that they want? Thanks for asking. Going back to having a 504 in the IEP, maybe because school is not financially responsible for the accommodation of the 504. I don't know if there's a financial piece to this because it's really interesting, and I think it's nice that you bring this up. I hope I don't butcher your name, Nadia. Because 504 has no federal funding associated with it. So schools get no federal funding for implementing a 504. Whereas in IEP, schools do get some federal funding. It's not a lot. It's 12% on average. So you financially you have an incentive to do an IEP because at least you're getting the 12%. But I don't know, sometimes schools 504s have less safeguards associated with them, so maybe that's more enticing. It's really unclear. Yeah, maybe Texas would be a great site. I heard it's just yes. Oh, so this is what I just said. So actually, I'm glad you brought this up, and this is kind of geeky, but I'll share this with you. So when IDEA was passed in 1975, Congress said that they would fund 40%, 40, of all special education expenditures. But in 75, they started at 3%, and they said, oh, by like 1982, we'll get up to 40%, and now we're in 2026, and we're at about 12. So yeah, I would say it's not my research that does that, but yeah, there's definitely a funding issue at hand here for sure. Thanks. So I'll just share these are acknowledgments for our funders and the students and people who have helped with this research. And this is our team. So I'm really, really proud to have a team of people that we work with, and our team is very intentionally inclusive. So I would say almost half of our team at this point either identify as having a disability or having a family member with a disability. And then really important in all of our research is partnering with the communities. This is just a really quick snapshot of community-based agencies that we partner with to develop and conduct all of our research. I'm happy to answer any more questions if you have them.
Yeah, it seems like there are a lot of great questions and great interest in this work, Megan. So that's wonderful. Yeah.
And I know throughout the presentation, we did have some folks raise their hand. I'm not sure if I saw them put a Q&A or anything in the chat. So if you would like to raise your hand, I can unmute you if that works best. Awesome. I see a few. So go ahead and I see yours, Alyssa. 1 second. All right, you're allowed to talk now. You will just need to unmute and you should be Good.
Maybe she's signed off.
Yeah. Hey, Alyssa, just checking in. See if you would like to unmute. Okay, so you're unmuted now.
Sorry about that.
No worries. Did you have a question?
I did not. I think I accidentally hit that. Sorry.
No worries, no worries. That happens. We do have, I think, a couple more questions went into the chat.
Let me do that. I'm going to find the exact link.
All right, Ricardo, I'll get to you. All right, you should be able to talk now.
Hi, can you hear me?
Yes.
Hi, thank you. And thank you again, Megan. This was an amazing presentation. So one quick question that I wanted to ask just in all of your research is how have you found uh, education, advocacy, and sort of supports differ in communities in Tennessee or wherever it is that you've done this research based on a technology gap? So, what I've seen in some of my advocacy has been as school districts are digitizing paper, right? Like even though IEPs are, yes, they're signed, but then they're uploaded somewhere, they're emailed, they're stored in some database. There might be certain families who maybe don't have ready access to a computer or ready access to the internet to research or to join webinars like this, for example. And so have you found anything like that in the communities that you've supported? And do you have any recommendations for how to bridge that gap?
Yeah, that's a really good question. I'm trying to think, when COVID first hit, when I was still in Illinois, early intervention services went to live video visits, telehealth,
Mhm.
and we recognized that there were probably quite a few families who wouldn't have access to technology, either like the actual device or to the data plan. And so got a few grants to loan iPads to families. And what we found is it's not so much the device, it's definitely the data plan, right? Like
Mhm.
you can have a phone, but you don't have the bandwidth or the minutes or whatever to um, maintain the session. But then also it's like the digital literacy skills and the comfort with digital literacy and how it's not the same as in person, right?
Yep.
And so like a lot of education and talking through, but also kind of like meeting people where they're at, because as a parent who was also trying to do physical therapy over live video visits, I could say like, yeah, I was like sweating, trying to like manipulate my son's body and then get the video and then listen. It's quite a bit to do. And so like really trying to honor people's preferences and that like telehealth or doing things with technology can be convenient, but it's not the best thing for everyone.
Mhm.
I don't know, it's a hard line to walk.
It is. I mean, that's sort of, I think, the biggest challenge, especially when, like I mentioned in earlier questions, right, that the first step, I think, for a family is to ask for help. And that already requires an incredible amount of courage to do. And then once you do that, the help may be coming in a way that isn't readily accessible to them, right? They might be a single parent, or they might be the breadwinner in the family. They might have other kids that they have to care for, and maybe even more than one child with disabilities at home that makes it difficult to just, put, how do I say this, life on pause to
Yeah.
try to be present to educate yourself. And so it's almost like everything is kind of stacked against you in
Mhm.
that regard. And then you just stop because it's very difficult to do. And so trying to do outreach to those kind of families who I think frankly need this the most
Yeah.
is a challenge.
Yeah. Well, and also I question, I don't think a 24-hour training is the right thing for everyone.
Mhm.
I mean, I think some people can do it with just watching like a video or reading a worksheet or whatever. I think some people need the 24-hour training, and I think some people need some like hand holding and more peer support to go through the process. And I mean, we haven't I would love to be able to get to the point where we could tell at the outset like who needs what so we don't waste people's time. But I think it's going to fall on like really different lines than what we expect. Like I think it has something to do with your disposition,
Mm.
like and how comfortable you feel like asserting yourself versus
And
some of
that
the other things.
I totally agree. Like, and I think, in any sort of like clinical or research-based like research, right? These data points wouldn't exist because they wouldn't be
They wouldn't
joining,
be in there.
right? They wouldn't be raising their hand.
Right.
So anyways, thank you for taking the question. Again, really enjoyed this. Very inspired. So thank you.
Good. Thank you.
All right. Did you have any last messages, Caroline, about?
Yes, I'll go on. So I know this webinar will get some of you guys CEU. So if you requested a CEU, give me 3 to 5 days, really until the end of next week to get those out to y'all. Um, and then our March webinar will be March 6th. That's a Friday, per usual. Same time, um, 11 to 12:30, and it will be with Dr. Shuting Zing. They are professor at Dell Medical School here at UT. And the title of their presentation is Understanding and Promoting Psychological Well-Being Among Autistic Adolescents and Young Adults. So if you're on our Autism Consortium listserv, look out for that registration link. And next week.
Great. Thank you, everyone. And thanks, Megan.
Yeah.
You really resonated with Texas here.
Okay. That's great.
Addressing a
Thanks
lot
for
of
having
needs.
me.
All right. We'll talk to you later.
Thank you.
Thanks, Megan.
Thanks. Have a good rest of your day.
You too.